Assalamu alaikum, hello and welcome to the Health Show, here only on the Islam channel, with me, Alistair Greener. As you know, every week we're joined by a health expert within their specialised field and discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show to help guide you in the right direction. And if you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. Today we're looking at skincare and we welcome Dr. Sunil Chopra, a consultant dermatologist who works primarily at the London Dermatology Centre, and he also has his own private practice. Dr. Chopra specialises in skin cancer, scalp and pigmentation problems, acne scarring, and he's an expert at treating the signs of ageing. He spent 2 years researching the blood and skin's nerve supply and has written 3 major international postgraduate texts. Dr. Chopra, lovely to see you on the show. Thanks indeed for coming in.
Great to be here.
And we'll talk to you a little bit more about skin concerns and so on in a short while. But first of all, we're going to show you a very interesting report. Now, in Mali, where skin conditions are widespread and skin doctors are scarce, physicians have turned to technology to treat patients remotely. The Pierre Fabre Foundation, which is part financing the programme, say the results have been solid, with 175 cases diagnosed remotely. The idea is to expand the project from Mali to other African countries. Let's take a look.
Turning to technology to treat patients remotely. In Mali, skin conditions are widespread and skin doctors are scarce. At this clinic, a pilot programme allows healthcare workers to consult with a specialist, thanks to Bogu, an app designed by a Malian programmer.
If they have cases of skin disease and they need the opinion of a specialist, they take pictures, which they send us. They go to a platform which gives dermatologists access to the images.
Mali only has 1 dermatologist per million people, and nearly 30% of the population suffer from skin diseases of some variety, ranging from eczema to leprosy. The 18-month programme has helped treat hundreds of patients who can't afford to travel to the capital.
When I came to see the doctor, he took pictures, sent them and asked me to come back the next day to get my prescription. We went to buy the tablets and lotion and I was healed. I didn't need to go anywhere. It was all done in Banamba.
It's not just patients benefiting from the technology. It also forms part of a training for doctors and nurses in the field.
We teach young people to learn dermatology from these images. In that way, if the image is good, we can make a diagnosis and give advice at a distance. We hope that this project will train health workers and improve the skin health of our population.
The idea is to expand the project from Mali to other African countries, reaching remote areas as long as they can get online.
It's amazing watching that story, Dr. Chopra, and it really highlights that skincare really is a problem. Sometimes people might be a bit dismissive of it, but it really is a serious problem which they were able to help out there.
Yes, it is. Unfortunately, the field of dermatology isn't given quite the same importance as, say, specialities such as cardiology, simply because so many people die of cardiac disease, and it's a major killer within most Western societies. But of course, skin disease results in a lot of suffering. And also, of course, when we're talking about skin cancers, the incidence of skin cancers doubling every 10 years. So more and more, in fact, skin cancers taken over cervical cancer in terms of the number of deaths now. So it is increasing as a problem. So it's not just a major problem now. We're talking about skin cancer actually being a major problem in the future as well.
Now, we'll come to the different diseases and different conditions affecting the skin in a while. But first of all, I'd like to just really get down to some real basics. So we hear this term dermatology. What exactly does that cover?
Dermatologists cover all skin disease, and not just skin disease. We also cover hair, and we also cover nails as well. So, and also a lot of our work also involves the oral cavity as well. So we're not just skin, we're hair, nails, and the oral cavity as well. So all of these so-called appendages to do with skin as well.
And you talked there about cancer, but what are the other typical conditions? Maybe we can go through a few of them, which are most common in Britain today.
Commonest ones, by far, acne. 60 to 80% of all under 18-year-olds suffer from some form of acne, so that's the commonest.
And I was one of them, so I know all about it, yes.
And also the other very common condition, especially in the South Asian population, is eczema, atopic dermatitis, which is the scientific name for it. That's very serious, very high incidence in the South Asian community. So that's a major problem as well. We also conditions such as psoriasis, vitiligo, where you lose pigment in the skin. All of those are major conditions that we look after. And of course, skin cancer is a major part of our workload as well.
Now, looking at individual problems, when somebody sees something change in their skin, that's always a good time to go and see an expert, because obviously that's a cause for concern. What are the type of things that people might notice that's different to their skin than what they're used to?
One, with acne, you'll see the obvious appearance of red spots, yellow spots with pustules, or what we call whiteheads, which are small white dots which are blocked pores, blackheads which are blocked pores as well. You may notice an increase in the greasiness of your skin at the same time, which would mean that you're developing acne. With eczema, you'd notice quite severe itching of your skin. Dryness is a major component of eczema as well, so much so that it interferes with sleep. So these sort of changes within these skin conditions should lead people to seek medical help.
Let's talk about acne, and it's something that is seen, well, that's just one of those things, you reach adolescence, you're going to get acne. At what point do you say, actually, this is more than just a couple of spots, this is actually a bigger problem that I might be able to get help with? Where's the boundary, if you like, between just, work your way through it and getting help?
That's determined by the patient themselves. I mean, I'll have patients that will have 3 spots on their face and they'll think the world is the end of the world, whereas I'll have patients who'll have 30 or 40 spots on their face and they're not too bothered by it. So it's all the perception of the patient, what they feel, and more young people, what with the social media, Facebook, with the sort of perfect skin on TV, young people are less and less tolerant of visible skin problems. So more and more we're finding that young people won't tolerate even 2 or 3 spots on their face.
Now, is that something that actually you should treat, or should you just accept 1 or 2 spots is fine, that's not a problem, and actually there might be a point where actually it's probably better just to let the body work it through itself?
I wouldn't say so, no. I think even 2 or 3 spots, if they're happening every week and you always got spots on your face, because there's always the danger of scarring. And once the scarring's there, it's permanent unless you treat it with lasers and things. And the other thing, especially in people with darker skin, the main problem with the people with darker skin is when people with dark skin get acne, you also get dark spots there. So those dark spots can last 3 or 4 months. So you can have 1 spot a week, for instance. At the end of a year, your whole face is covered in dark spots. So within the darker skin group of patients, it's actually quite important to treat early, because you don't just treat the acne, but you also treat the darkness that the acne causes as well. So I think treating early before it gets a problem such as scarring or causing increased pigmentation is very important. And there's some very effective treatments available. So it's well worth treating acne patients early before it causes any long-term problems.
And what actually causes acne in the first place? We recognise it as something that happens when you get to adolescence. Some youngsters, really are badly affected, and some others seem to just sail through without a problem.
Yes, I mean, acne often first occurs when the child undergoes puberty, because there's hormonal changes. And these increase in hormones stimulate the sebum, or what we call the sebaceous glands. If you rub your finger on your nose, you find there's a shiny sheen on your finger. And that's an oil called sebum that your skin produces in order to waterproof your skin and guard against infections, because it's got antibacterial components in the sebum. But if that sebum's too thick, what it does is it blocks the exit of the gland itself. Now, you still continue making the sebum, so you get this great big bag of sebum which juts out onto the skin, and that's what we call a comedone, or what ordinarily we'd call a whitehead or a blackhead, just a blocked pore. Now, there's nothing bacteria-like better than a load of sebum not draining anyway. It's like honey to a bee. So the bacteria will come in and infect that sebum, and that's when you get the redness, the inflammation, and the yellow pus. Now, after that, if, as a lot of teenagers do, they squeeze those spots, a lot of that pus doesn't just come on the outside, it goes on the inside, and that's what causes the scarring. So you end up with scarring as a result of the acne. And in people with darker skin, that inflammation of the skin stimulates the color-forming cells, and thereby you get the dark spots resulting from it as well.
Let's do a little bit of myth-busting now when it comes to acne. So first of all, is there any difference between boys and girls, male and female, with acne? Are one sex more prone to it than the other?
In general, acne tends to affect all sexes. In women especially, though, there are certain conditions that can predispose to acne, such as a condition called polycystic ovary syndrome. And that's when the female produces too much of the male hormone called testosterone from the ovaries. And that can lead to quite severe acne in females. But in general, acne affects both males and females, but there's special forms, certain causes that are hormonal, which are unique to women.
What about things like makeup, things like these facial scrubs, and the things that you can get pretty much in the aisles of a supermarket or pharmacist? Let's first of all talk about makeup. Does that make a difference? If girls wear a lot of makeup because obviously they want to cover up, and actually increasingly boys are using some form of cover up as well, does that actually, we hear sometimes that might block and make things even worse? What's the real truth on that?
Yes, that's true. If you use makeup that's too greasy or oil-based, that can definitely block the pores, and we tend to recommend, if you've got acne-prone skin, to use mineral-based makeup, which is less likely to block your pores. So that's a very important choice in someone who's got greasy skin or is acne-prone, to always make sure that the makeup you use is mineral-based rather than oil-based.
And what about some of these facial washes which really can dry the skin? I remember using one all those years ago, and your skin felt really, really dry, and you weren't too sure, was I overdoing it, underdoing it, things like that. What's your view on those kind of treatments?
The washes you can buy over the counter basically consist of one of three things, or a combination of these three things. And those are washes of the face with a substance called salicylic acid, which has aspirin in it, or a wash called glycolic acid, and the other one you can buy over the counter is something called benzoyl peroxide. Now, unfortunately, all of these treatments can dry the skin. Because that's what you're trying to do. Because there's too much oiliness to the skin, you're trying to remove that oil and trying to unblock the pores. So a lot of acne treatments do cause skin dryness, in which case what you do is the frequency of washing with these substances should be reduced. And you can always, after having used the wash, use an oil-free moisturizer. It's absolutely crucial that the moisturizer you use in this situation is an oil-free moisturizer.
And actually, I want to come on to like general health care of your skin later on. Just to finish up with people who are suffering from acne, what about adults who get it? Because some people keep getting acne right the way through their lives almost.
Yes, what's interesting, and one of the myths about acne is that it's a disease of teenagers. It isn't. Like you say, some of these teenagers can carry on with their acne, and it continues throughout their adult life. The other is a lot of people don't even have any acne as teenagers at all. It's when they get into their 30s and 40s, they suddenly have adult onset acne. So you're quite right, it isn't just a disease of adolescence. Adult onset acne is one of the commonest conditions we see.
And finally, what about things people can do for themselves? So, for example, we hear eating too much dairy product or chocolate can cause more acne, something about the food we eat. You've already talked about actually, squeezing the spots or maybe touching your face too much or maybe having dirty hands and things like that. What about all of those things? Is that just old wives' tales, or is there some truth in it?
The question of diet in acne is a very controversial one. Some 20 to 30 years ago, we did not believe that diet had anything to do with acne. But there were certain observations. I talked about a condition called polycystic ovary syndrome earlier on. And in a lot of these polycystic ovary syndrome patients, they have high levels of a hormone called insulin. Now, we now know, because insulin is much easier to measure now in blood. In the old days, it used to take a long time, was very expensive to measure insulin. Now it's very easy to measure insulin in the blood. And what we found in a lot of studies is foods that increase your insulin levels in your bloodstream do predispose you to acne. And of course, foods such as chocolates, biscuits, cakes, sweet foods will cause insulin levels to rise, and the theory is thereby causing more acne or increasing the severity of acne. A lot of studies show there is a link between sweet foods and acne, and some studies show there isn't. So it's quite controversial. My personal opinion is that I do believe a lot of patients will tell us anecdotally, doctor, when I ate too much chocolate over Christmas, I did get more acne. So I actually tend to believe that. I do believe that sweet food does predispose to acne.
And is it a sign that maybe you don't wash enough or anything like that? What about just normal dirt? Does that make any difference at all?
It's a myth that people with acne have dirty skin. Of course, if you don't wash your face at all, then all the dirt will clog up your pores and cause acne, but we find that's very rare. Most people are hygienic. Most people tend to wash their face at least once or twice a day. So, yes, if you neglect to wash your face, that can cause...
But basic hygiene, you're fine. Brilliant. And that's really good, really, really helpful with, all of those points about acne. And of course, if you would like any questions, particularly about acne, again, as always, just get in touch with us. But I'd like to go on to other things, and specifically those conditions which affect skin of a darker pigmentation. We were talking actually before we came on the show about, again, some of the myth-busting things there about what makes a difference and what doesn't. What's your observation on the whole, particularly looking at darker skin?
Darker skin, the major problem is problems with pigmentation, either too much pigmentation or not enough pigmentation. For instance, we talked about acne earlier on. One of the major problems of people with darker skin with acne is the dark spots they get as a result of it. And another major condition, primarily, but not solely, women get is a condition called melasma, where you get dark patches on your cheeks, your forehead, your nose, and your chin, which can be hormonally based. It can first appear in pregnancy or when you start the oral contraceptive pill or too much sun exposure. So melasma is a major condition and major thing that Asian women suffer from. And then another major condition that people of color suffer a lot is a condition called vitiligo. Now, vitiligo was made famous by the pop singer Michael Jackson, the condition he had where you lose pigment in your skin. And one of the major myths that we have in these, particularly South Asian population, is that if you eat fish and milk in the same meal, that can predispose to vitiligo. Now, that is a universally held belief, and it is a complete and utter myth. There is no link between eating fish and milk together and vitiligo. No link whatsoever.
Is there anything at all that that could potentially head someone in that direction?
Well, what's very interesting is when South Asians, when we get married, we tend to put turmeric on our skin. And the reason why we do that is to lighten the skin. Because, of course, the association with light skin and beauty is quite strong within the South Asian community. But some work done by Professor Schaurachter in Germany showed that turmeric, when you're trying to treat vitiligo patients, they are less likely to repigment if they carry on eating turmeric or saffron. So in a lot of our vitiligo patients, we ask them not to eat turmeric or saffron, because that sort of slows down the repigmentation
And it's
process.
interesting, isn't it? Because certainly turmeric has been seen as one of these new superfoods, isn't it? For, I believe it's for the heart or something. So it's just the way things work sometimes. It helps in one area, but might not in another.
It's a very, very powerful antibacterial agent, so it is used in a lot of skincare products. And it lightens the skin as well, and it smoothens the skin. But in the context of vitiligo, we tend to ask patients not to take any more. And turmeric's really used extensively in Asian cooking.
Absolutely. And what about the treatments for vitiligo? What sort of things can you do for patients?
You see, vitiligo happens because your own immune system starts attacking your colour-forming cells. It's what we call an autoimmune condition. Now, there are ways of stopping the immune system from attacking the colour-forming cells. There's, not recent, but in the last 2 decades, there's been a treatment called topical tacrolimus, which was initially licensed for use in eczema. And what that does is damp down the immune system wherever you apply it, and that stops the attack on the skin. And also, the substance called tacrolimus causes the ordinary color-forming cells from the normal skin to migrate into the vitiligo. So this cream, just a mere cream that you use twice a day, can help treat vitiligo. Now, more controversially, you can combine this treatment with a treatment called narrowband UVB, which is ultraviolet light. Very controversial, because not only are you damping down the immune system, you're adding a known cancer-causing agent called ultraviolet onto it. Now, a lot of people were saying, now, you can't do this, you may cause skin cancer in the future, but recent work has shown the people with vitiligo are 300% less likely to get skin cancer. So vitiligo protects you a great deal against skin cancer. So a lot of people argue that when we do combine this tacrolimus cream with UVB, that vitiligo patients are so protected against skin cancer in the first place that we're probably not putting them at too much risk when we treat the vitiligo. We probably wouldn't use that combination in Caucasians, because Caucasians have a high incidence of skin cancer. But Asians, South Asians or Africans have literally hundreds of times less likely to get skin cancer than Caucasians. So we're less reluctant to use those combinations of treatment in people of colour.
And I want to talk a little bit more about looking after our skin, and we're certainly talking about, you know, being in the sun and things like that, and you hinted there about the dangers for Caucasian skin as opposed to South Asian skin, and we'll definitely talk about that in a while. Very, very quickly, before we go to the break, I'd like to talk about psoriasis and eczema. Again, what causes that, and are treatments effective?
Now, eczema is, a lot of it is inherited condition. There's a gene called the filaggrin gene, and what this, the protein, the thing that filaggrin makes, is it keeps your skin cells tight together. However, if you've got a defect in the gene called filaggrin, your skins aren't tight anymore. They move apart. And because that gap in the cells allows water to evaporate, that causes dryness of your skin. And of course, because you've got gaps in the skin, bacteria and allergens get into the skin and cause the skin to have an immune reaction and inflames up the skin. Now, of course, you're going to start scratching there because you're itchy. That means you damage the skin even more, so more bacteria get in. And also, eczema is a condition where there's an overreaction to substances on the skin. So the immune system is hyperactive. So someone like myself who doesn't have eczema, if I have a bacteria on my skin just leaves it alone. But in an eczema patient, they'll over-attack this bacteria and damage their own skin in the process. Eczema is much, much more common in immigrants, especially South Asian or immigrants coming especially to London for some reason. London's got one of the highest incidents of eczema in the world. And also South Asians, when they first emigrate to especially London, start getting the eczema for the first time.
Well, maybe we can talk about that and why that is after the break, and we can also talk about some of the things you can help to prevent getting some of these skin conditions. It's a terrible pun, but it feels like we've only just scratched the surface here. Lots more to talk about. And what we should say at this point is that we must stress that should you suffer from any medical problems whatsoever or have any health concerns, it's always highly recommended that you actually consult your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. As you can tell, we've got lots more to talk about, but now it's time for a quick break, so don't go away. Welcome back to the Health Show, where our topic today is skincare. Now, last April, the Ivory Coast banned whitening creams because of the negative health effects associated with them, such as white spots, acne, and even cancer. But many Ivorian women are still using creams for depigmentation, despite the fact that they contain dangerous chemicals and all the government efforts to stop the practice.
Changing skin tone, no matter what the cost. In Abidjan, as in other African cities, many women want a lighter skin. Florence is a hairdresser and prefers to be pale, despite her natural tone.
I like fair skin tones. I like them. I don't want to blacken. I just don't want to.
Like Florence, a huge number of Ivorian women whiten their skin. They are nicknamed the Chachos. Some Chachos whiten their skin to follow fashion, but others say they're forced by their husbands.
It's the husbands who push women to do that. It's not the women who love the product. They are forced into it.
Lightening products exist in several forms, like lotions, soaps or creams. Made with mercury, corticoids and hydroquinone, a bleaching agent banned in Europe. These products can cause spots, scars and white blotches, as well as more serious illnesses.
The infectious complications can be easily treated, but the complications such as diabetes, hypertension, renal failure, these complications are so severe that patients will need lifelong follow-ups.
Last April, the Ivorian government banned skin whitening products, but more than 2 months later, they are still on the market. Tinan is a victim of skin whitening products, and she believes the regulation should be stricter.
There are things that are forbidden to sell today that I still see on the market. Personally, I see that regulations are not enough. We also need to educate people.
Education, as well as sanctions. The Ivory Coast has set up a national committee to ensure that the ban is effective. Women who flout the ban now risk a fine ranging from 75 to over 500 euros.
Now, it's a fascinating report there, Dr. Chopra, about the skin whitening. How big a problem actually is it?
It's a major problem. In Africa, it's a major problem, and it's also a major problem in the UK. You can buy illegal skin whitening products in a lot of hairdresser shops, especially the African hairdresser shops. Completely very dangerous, containing high concentrations of hydroquinone, steroids, and even mercury. Now, it's not quite accurate saying that hydroquinone's been banned in Europe. It's been banned as an over-the-counter product. We still use it as a prescription medication in our practice. It has to be used under supervision of someone who's skilled at looking at skin. So hydroquinone is available, but not over the counter. It's prescription only now.
And it's a real shame that is actually still in existence in 2018, when one would hope that people are far more accepting of who they are and what they look like. And sometimes skincare is seen as a vanity issue. How much of skincare is actually a medical issue?
A lot. I mean, 20% of all that we see as dermatologists are a sign of other things going on within the body. For instance, if you're diabetic, There's certain skin changes you undergo if you've got TB. Lots of medical conditions can be diagnosed by looking at the skin and nails and the hair. So at least 20% of what we see is related to other conditions, so very medical indeed. And of course, eczema, acne, psoriasis, vitiligo, all of these are conditions that cause a great deal of suffering and really impinge on people's everyday lives and stop them from functioning properly. So they are really serious medical conditions. And of course, we do treat the signs of aging as well, which I admit is a vanity issue, but I think that's becoming more and more important in today's society. The way we looking younger is considered a major...
Well, let's be honest, we all want eternal youth, don't we?
That's right.
I want to come to some of the treatments. How much have they improved over recent years? Has science really helped out to make some big leaps in that direction?
I wish I could say that was the case. I mean, I think in terms of the aesthetic treatments of skin, there's been some major advances in terms of the laser treatments, a lot of the growth factors that we can now isolate and add to the skin in terms of making the aging skin look better. Unfortunately, when it comes to the major diseases, acne, eczema, psoriasis, there haven't been huge advances. There are a new group of drugs in the inflammatory skin conditions called the TNF inhibitors, which have radically changed the way we treat inflammatory skin disease. And that's the only actual advance there's been. In terms of psoriasis, we're still using more or less the same treatments we used in the 60s.
And how effective are they?
Now, using the right combination, they are very effective treatments for acne, eczema, and psoriasis. Unfortunately, for eczema and psoriasis, there are no cures. And so one is left with managing the symptoms and teaching the patient how to manage their condition and to remain symptom-free for as long as possible.
Now, you talked earlier on about how, raising insulin could possibly aggravate things like acne and things. What about other aspects of our nutrition and diet and exercise and so on that could affect our skin and maybe even aging?
Yes, in fact, weight gain, especially, unfortunately, especially in South Asians, when we have what we call central obesity, increased obesity around the abdomen, we now know, because we can measure insulin, is that a lot of people undergo what's called the Metabolic Syndrome. This is the syndrome before you become diabetic. And so you gain weight around your abdomen, you put weight around your liver, so you get what's called a fatty liver. And all of that leads to what's called insulin resistance. So you need high levels of insulin in order to maintain a normal glucose level. Now, those high insulin conditions can lead to a whole host of major problems. I mean, acne is one of them. There's a condition called hidradenitis suppurativa, where you get huge boils under your arms and in your groin. And in psoriasis patients with psoriasis, there's a strong link between insulin resistance, high insulin levels, and psoriasis. And of course, high insulin levels and metabolic syndrome predisposed to strokes, heart conditions, loss of hair, male pattern balding is accelerated, so you've got that sort of classic fat man with a bald head.
And is it one of those situations where actually what comes out in your skin is a result of the other health things? So actually deal with the other health things and then the skin thing will be okay, rather than saying, OK, we'll deal with this skin thing, so especially, for example, if you've got diabetes.
Precisely. Nutrition and exercise are major things that you can do yourself at home. Have a good balanced diet with lots of fruit and vegetables. Do regular exercise, because that will mean that your metabolism, your insulin levels will stay normal and thereby lead to healthy skin. So yes, exercise and good nutrition are vital for healthcare.
And other foods that one should particularly avoid in terms of skin, in other words, the sort of nice sort of, we have a glow, don't we, to our skins when we're very healthy, and obviously there's aging as well. So are there any things particularly to avoid?
Yes, sweet sweet foods, cakes, biscuits, chocolates. All of these are major problems for the skin. They really are. fatty foods, gaining weight, all of that's pretty bad for skin. Having enough vitamin D is crucial for skin health as well. So having enough vitamin D in the diet. Now, another major problem, especially in South Asians, is iron deficiency. It's a big problem, especially in women, because women menstruate and lose iron every month. And also because South Asians have a lot of what we call phytate in our diet. A lot of the chapati flour or the flour that's made to make naan are phytate, and they grab hold of iron and stop its absorption. And therefore, South Asian women especially tend to have low iron. And another thing which people don't know about is tea drinking. If you drink tea straight after a meal, that reduces your iron absorption by 300%.
Really? Wow.
That's right. So a lot of Asian women who have heavy periods, are vegetarian, and drink tea end up with a very low iron and start losing their hair. And
so how long should you leave it after a meal before you do have tea?
At least 2 hours.
Really? Okay.
Yes. So drinking...
Now, I've often heard tea is a very good thing before a meal. I know the Japanese, for example, will have miso soup as a way for digestive purposes, but tea, definitely not afterwards.
Yes, and that includes green tea, jasmine tea.
Right.
They all inhibit iron absorption, so one has to be very careful about that.
And that's after any kind of meal, because sometimes people have things like peppermint tea after a meal because they think it helps their digestion, but actually they might be affecting their iron levels.
Yes, they are, precisely.
Fascinating.
So that's a major thing. So if you drink tea, it's fine in the morning, have it for breakfast, but not after dinner, because you will get reduced iron absorption. And one of the commonest symptoms of a relatively low iron is hair loss.
And actually, that's quite an interesting thing, because people wouldn't necessarily see hair loss as being a skin condition, unless obviously you've got a severe case of psoriasis or something like that.
That's right. In fact, one of the main problems is that when one goes to one's GP, the GP will do what's called a ferritin, which is a measure of the iron level. Now, the lowest ferritin a female's allowed to have is about 13, but to have healthy hair, it has to be over 40. So although you may get the blood test done and say your ferritin comes back as 20, often erroneously the patient's then told that, okay, your ferritin's normal. But to have healthy hair, the ferritin has to be at least over 40, and to have really good hair, it has to be over 60 or 70. And therefore, even though you have a normal ferritin, still giving iron can stop the hair loss and restore the hair growth to its normal level.
Another thing we often hear when it certainly comes to aging, and obviously it has its own health problems with lung cancer and so on, but we often hear this thing that smokers will have worse skin, it'll age them more. Is that a myth, or is that true?
That's very true indeed. In fact, for each year that we live over the age of 25, we lose 1% of our collagen. Now, when I pull my finger like this, or my skin like this, the reason why my skin doesn't break is because the collagen has given it strength. When I let go, the skin bounces back because of the elastic tissue springing it back. Now, after the age of 25, you lose 1% of your collagen and elastic tissue. If you smoke, you're losing 3% per year.
Wow.
So you're losing 3 times.
And that's all over your skin, not just your face.
All over.
Right.
So you're actually, gravity starts taking over more. So your skin is likely to age 3 times more if you're a smoker.
Now, some people might be watching thinking, yeah, but that's okay, I only have maybe a couple of cigarettes a day. At what point does this actually kick in?
Do you know, recent research has shown 1 cigarette a day almost doubles your risk of a heart attack and stiffens your arteries. Now, no one's ever looked at the effect of 1 cigarette on collagen. Well, they have, actually. It has been studied. A group at Imperial actually did cosmetic procedures, and one group was allowed to have a cigarette and the other group weren't allowed to have a cigarette. Those who smoked produced a lot less collagen after a procedure than those who didn't. So 1 cigarette straight after a procedure reduces the chance of that procedure from succeeding. So 1 cigarette minutes afterwards will cause damage to your skin.
And it's amazing. Obviously, this is damage that you're not going to see maybe in a matter of weeks, months, but certainly over a period of years. I'm guessing that's when it really starts to show.
Yes, it does. I mean, but really, cigarette smoking, I can tell a cigarette smoker as a patient when they sit in front of me. You can immediately tell they're a smoker. They're old for their age. They have a different coloring to the skin. Cigarette smoking is actually one of the worst things for skin health there is. And of course, excess alcohol intake is another one. Excess alcohol intake is also, it goes in with the sweet foods, the chocolates, raises insulin levels, increases blood pressure, really is not good for the skin.
You know, we need 2 programs about this subject because I've got so many more things we want to talk about. But before we get to the end of the show, I really want to talk about creams, potions. I mean, some people are spending fortunes on anti-aging creams, on youthful creams, night creams, day creams, you name it. What's your view on all of that? We tend to get the impression from a lot of programs we see on TV that actually the majority of these creams actually don't really do an awful lot.
That's true. Immediately, I'll tell you that. And I'll tell you a great example of this. Which magazine, which is a consumer magazine, did a survey on skin sunscreen, sunblocks. And they did an analysis on how effective they are. And they compared some of the most effective ones. And you can pay hundreds of pounds for a sunblock. And of course there's a cheap supermarket version, and they found the most effective one was actually the cheapest from the cheapest supermarket brand there is. So do not think because you're spending vast amounts of money on a skincare product that's necessarily better. In fact, in a lot of instances, a sunblock costing £3 is good as one costing £300.
And what about just, you know, the principle of moisturising your skin? Again, is that something that we need to be bothering about? Or again, is that one of those things, you know what, it's not really going to make much difference?
As we get older, our ability to produce sebum reduces and our ability to hydrate our skin reduces. So as you get older, it is essential that you moisturise your skin. However, we talked about acne initially. If you've got greasy skin, you obviously don't need to moisturise. But most people do need a moisturiser, and if you've got acne-prone skin, go for an oil-free moisturiser.
But I presume you would advocate don't spend a lot of money on it, just any moisturiser, the chance it'll do the job.
Something that suits you, that feels good on your skin, yes, of course. You can get half a kilo of a decent moisturiser for about £8. That's good enough.
OK. What about some of the other things? I know someone who puts olive oil on his skin. He claims that works well. Somebody else is coconut oil. We hear about people steaming their faces and so on. What about all those sort of home remedies, these sort of DIY jobs?
Well, you see, olive oil, coconut oil moisturise the skin. They're good moisturisers. They're great if you haven't got acne-prone skin, so they're good for using on the scalp. What a lot of people don't know, though, is if you put oil on your scalp, that can predispose to acne on the face, because the oil at room temperature is about 22 degrees. When you put it on the scalp, it's roughly 34 degrees. So a thin layer of oil comes on your face and blocks your pores and causes something called pomade acne, so be careful of that. So if you've got acne-prone skin, try and keep away from these oils because those will block your pores. But if you don't have acne-prone skin, coconut oil, olive oil is great. Japanese women, do you know when they boil their rice? They actually keep the rice. They keep it cool because they then use that rice water to wash their faces, and that's got a substance in it called kojic acid, which causes uniformity of the skin complexion. So that's another great thing to do at home.
Lovely.
Don't throw
Have you got
away
any
your
other
rice water.
any other tips? I'm loving this. It's great.
Well, the rice one's excellent. That's
Yeah.
why a lot of Japanese women have excellent skin and very even skin. So don't throw away your...
Actually, before we go any further, what about men versus women? You know, it's becoming more acceptable for men to moisturise and to look after their skin. Is there any difference between male and female skin in the way that we should look after it?
Not really. It's made of the same structures, and therefore male and female skin have basically the same rules in looking after the skin. There's not really that much difference between this. Men's skin tends to be thicker, but you know that doesn't really determine how we look after the skin.
So men should moisturise?
Yes.
OK. Let's talk a little bit more about the clinic and the work that you do. Who are the most common, or what are the most common problems that people come to you with in your clinic?
We have being in central London, we have a very diverse group of patients. We will see vast amounts of patients from the Middle East, which have their own problems. We see a lot of people, stressed out executives from the city. We see a lot of our local population, so we see a very diverse. As you know, London's got hundreds of nationalities living within it, and all having different predispositions for different conditions.
And you mentioned that many coming in from other countries, their skin suddenly deteriorates coming to London. What is it about London? Is it the air? Is it the pollutants?
This is a mystery. There are two cities in the world which have unusually high incidence of allergies. One is London, and the other is Wellington in New Zealand. Now, some people's theory was, well, is it the pollution in London? No, well, people that come from Bombay or Mumbai or Delhi come to London, they'll get eczema. Now, it can't be the pollution because there's nowhere more polluted than Delhi. So we don't actually know which factor it is that causes enhanced allergy in a city like London. Is it the water? We don't know. But there are factors within these two cities that predispose to more allergies, and we don't know what those factors are.
People's view on their skin is absolutely we want to look good, but also we want to be healthy as well. What sort of examples have you got where you've really been able to maybe turn someone's life around, where actually doing something for their skin has actually improved their mental health and their sort of self-worth and who they are?
One of the major conditions I treat a lot of is the condition I talked about earlier on called vitiligo. Vitiligo is when your own immune system attacks your colour-forming cells and you get great big white patches. Now, that can be very stigmatizing, and it can really affect people's confidence, especially when the vitiligo affects the face. Now, when we do treat someone with vitiligo, a patient from Pakistan that I saw recently, he wouldn't even look me in the eye, young boy, completely lost his confidence. He had great big white patches around his eyes. Treated him, it's all gone. You won't believe how confident he's suddenly become almost overnight.
So you could get rid of it completely?
You can't cure it, but you can certainly bring the pigmentation back in a lot of conditions.
And is that where you're then going to have ongoing treatment for something like that, or you've just made a change and that does it?
In a lot of cases in vitiligo of the face, it's highly treatable and the pigmentation remains, and you don't have to carry on treating. Sometimes the vitiligo comes back on the face and you just retreat it again. The other condition is like acne, severe acne. There is a very effective treatment called isotretinoin for acne, and you'll get young teenage kids come in barely looking at you in the eye. They're not performing well at school because they're so self-conscious. You give them this drug, 5 months later, the acne's gone. There's a new human being sitting in front of you. Their confidence levels have gone up. All of their level of happiness is just visible the minute they walk through that door.
Are most of the treatments that you have, are they drugs and creams, or do you sometimes have to resort to surgery?
We sometimes have to resort to surgery, especially in scarring conditions. More and more, instead of surgery, we are now replacing a lot of our treatments with lasers. Now, you asked earlier on about the advances in dermatology. The major advance in how we treat skin is the new generation of laser treatments, very advanced. Now these lasers are allowing us to do things, whereas previously we used to have to use surgery in order to treat the skin. Now we're actually doing all sorts of things with our lasers, which means that we don't have to do invasive surgery anymore.
And what are some of the other misconceptions? You've done a fantastic job on today's show at doing some myth busting, and I think all of us are going to be having rice for our dinner tonight and saving that water. What are some of the biggest misconceptions that people have about skincare? You raised one there about people from South Asia, on the whole, aren't suffering from melanomas as much as people with fairer skin. What other kind of things would it be good to make sure that people realise?
Well, the other thing I have to really bust a myth is that South Asians think that if you have fish and milk together, it causes vitiligo. It doesn't. I think that's really important.
Yeah.
Because the English cook their fish and milk. Cod Mornay is made of dairy products. So that's
and interestingly enough, you said to me before we came on the show that actually people with fair skin do get vitiligo, but it just doesn't show up as much because of the nature of the skin colour in the first place.
That's right. And the other thing with Asian or darker skin is that sun avoidance. Now, one of the major problems people of colour have is vitamin D deficiency. either because our sun needs a lot more sun in order to create the same amount of vitamin D, and also because of our social norms. We tend not to like exposing parts of our body in public, and that's another reason why we get less vitamin D. But it's essential that in the summer, when there is the sun out there, that you get at least 15 minutes of sun exposure to build up those vitamin D levels.
You know what? I wish we could talk for another hour. It's been absolutely fascinating. Thank you so much indeed. But unfortunately, that is all time we have for on this particular episode. But I'd like to thank our guest today, Dr. Sunil Chopra, for sharing his incredible experience as a consultant dermatologist and giving us a greater insight into skincare from a medical viewpoint. But once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. As always, if you'd like to find out about anything more on the subjects we've talked about today or any of our shows, please do get in touch. healthshow@islamchannel.tv. Well, that's it from us. Thank you so much indeed again for joining in. Thank you to our guests, and we'll see you again next week. Assalamu alaikum.